Hello, I'm Dr. Gökay Bilgin from Smile Hair Clinic. Today we will check our patient's Victor's photos and file. We performed him a DHI hair transplant. If we check his photos before the operation, you can clearly see that he needs hair transplant for the whole head. He lost his hairline, he needs to be fixed hairline and the first half of the frontal head. And also after a tiny part in the middle of the head, he also lost significant density in the crown. So we extracted from him as much as we can. I decided to draw him a bigger zone for the hair transplant and made him a high hairline because actually this kind of patients are for the 2-session operations. What I mean by 2 sessions is you do the first session and you wait for the donor zone to heal for a year. After a year, you transplant the second session. So we performed DHI hair transplant as our patients wished. And I want to clear one thing, both FUE and DHI has their own pros and cons. So they are not superior to each other. Please always keep this in mind. What we extracted from his donor zone is 4,900 grafts. Some may say that it's a lot and if you transplant that many grafts on the scalp, they will not grow. But it depends on the surgeon's expertise and the team's expertise. So you will see this now very clearly. So if we check our patient's first month mark, he lost most of the grafts and his redness is still there, so it needs a couple of months to redness to go away. And also donor zone healed sparse and his donor zone will not look really good after the first month when you extract grafts around 5,000, but you don't have to worry if you have this look after the first month of your donor zone, because it will be healed in a couple of months and it will look much better after the healing process. When we jump to the 3rd month mark, you will see that hair started to grow, but they are like baby hair, they are not creating density, and his donor zone look really good after the 3rd month. 6th month is where things starts to get exciting, because the hair really start to grow after the 6th month. His hairs and the frontal line has started to grow. He has a little density increase in the crown too, but as I told you, this is only the beginning and the donor zone seems really nice. And in the 9th month, crown is covered more, donor zone looks pretty nice, and the front is still lacking density, but it looks really good. When we reach the 12th month mark, hairline is dense and nice. His donor zone looks nice, crown looks nice. He looks like a new person totally. He looks very different. You can see how his look changed, and he is really younger, 10 years. So I'm pretty sure that he looks very happy about his look. But we always need to keep in mind that actually he needs in the beginning he needed 2 sessions, so he may need to come for a 2nd session. The need for the hair transplant is an individual's choice. So if you are happy about your look, you don't need to have a hair transplant. If you want a better look or want density increase, even a small zone, that you may need to have a hair transplant. So for this patient, we tried our best and give him the opportunity to have 1 session surgery and live happily ever after. It depends on his choice. Thank you.